Cities across the country are responding to the new surge of COVID infections driven by the Omicron variant. The mayor of Atlanta issued an executive order today reinstating the citywide indoor mask mandates after positive cases spiked ahead of the holidays. Even the incoming mayor announced he tested positive for the virus on Monday, just 2 weeks before he's set to be sworn in. In Washington, D.C., the mayor announced the city's mask mandate would also go back into effect. For 2 consecutive days last week, the city saw the highest single-day rate of infections of the entire pandemic. The mayor also ordered the city's 37,000 employees to get fully vaccinated and boosted. The option to test out by showing negative results will be revoked. Both New York State and California also reissued indoor mask requirements last week. The soon-to-be mayor of New York City even postponed his inauguration ceremony set for January 1st in light of the surge. Boston, Oakland, and Chicago will all require proof of vaccines to enter certain businesses starting in January. In the Midwest, the rise in hospitalizations is handicapping medical centers like in Minnesota, where ICUs are nearly 80% full. Doctors from the state's largest healthcare systems took out a full-page ad pleading with residents to get vaccinated, saying, "We're heartbroken, we're overwhelmed." Joining me now to discuss, Dr. Cedric Jamie Rutland, critical care and internal medicine doctor and owner of the Rutland Medical Group. Dr. Rutland, what do you make of the new initiatives that the states and the cities are putting into effect? Do you think that what they are doing is enough?
You know, I think that what they're doing is appropriate. I don't know if what they're doing is enough. When you look at masking definitely reduces the amount of viral particles an individual is going to be exposed to, definitely necessary to do. But when you look at other policies and when you look at increasing access of healthcare as a whole to certain regions of the country, I think that we have to do a better job right there.
New York City is offering $100 to people to get booster shots in city-run sites between now and New Year's Eve. Do these kinds of monetary incentives actually work in to get people shots and boosters?
You know, I don't know if the monetary advance works, but I do know that marketing and advertising works. And if it takes $100 to get somebody to talk about it more often, I'm cool with that. And I do know that as we continue to hammer down and say, get vaccinated, get boosted, I do see more people headed that direction and getting vaccinated and getting boosted, especially as this pandemic continues.
Do you feel optimistic that we can actually control the spread of this virus going into the Christmas holidays? A lot of people have already taken off. There are a lot of kids now back in the home. People are planning. If they were going away on a trip that required a ticket, they've already bought those tickets. People are hesitant to cancel those trips. A lot of people are trying to get tests in order to continue to go on the trips and to have people into their homes. There's a lot of pressure this season to really get together. People have put that pressure on themselves. Can we control this virus and this surge in an environment where everybody wants to do something that is inherently dangerous on some level?
Yeah, you know, it's definitely going to be difficult to control, but I do think that individuals need a plan. And what I mean by that is you need to write down what your plan is going to be should you develop symptoms or become infected or become exposed to somebody with SARS-CoV-2. Who are you going to call? Who's the physician you're going to visit? Where are you going to get tested? Here's one thing. If you were exposed to SARS-CoV-2 infection and you live with this person, it's your spouse, and you want to go and run and get tested and you know they have it, there's no reason to. You likely have it and you need to behave in that manner. My little sister just tested positive. She can't come home for Christmas, right? So she's not allowed to spend time with us because of the positiveness of that test. So there are certain strategies that can take place. And again, I think planning is number one. What's your plan? Who are you going to call? What are you going to do? But I also think that plan depends on healthcare access. And we have to do a better job of giving people access to the healthcare system in general.
We're hearing more and more about breakthrough infections with the Omicron variant, but we're also hearing more and more about mild cases with that variant. Is it time for us to shift the focus from infection to hospitalizations or death?
Yeah, it's been time to do that. First of all, the term breakthrough infection is a misnomer. What a vaccine actually does is it creates the appropriate proteins and substances to be able to recognize the presence of an infection. It doesn't prevent you from getting infected. It allows your immune system the ability to locate it and see it and clear it quicker and more efficiently. It doesn't prevent infection. That's one. Number two, hospitalizations and death have always been the most important from my standpoint and in my mind, because that's what vaccines do. They prevent hospitalizations and deaths. They're not necessarily preventing infection. They're preventing symptoms. They're preventing the immune system's significant response to the presence of the virus, which is what ultimately causes severe disease and death.
The New York City is still planning to go ahead with what I think is the biggest New Year's Eve celebration in America, if not the world. Only one sports team has put their entire season on pause. That's the NHL. Do you think that these big events, hosted by cities, sponsored by, big sporting leagues, should lead the way as an example setter and say, we just can't do it in this circumstance?
Yeah, that's an interesting question. I understand that life must go on, but I also think that big gatherings and big events in which people are unmasked do lead to significant transmission of the SARS-CoV-2 virus, Omicron, Delta, Beta, whatever it is. But I do know that there was a study done, I think it was in Europe, and they were looking at big concerts. And as long as people were getting tested before they went to the concert and they were wearing masks at the concert, and sometimes people don't, it didn't necessarily increase the risk of transmission. But again, that requires a plan. Most of these big events don't have a significant plan.
Right, and then, as you just mentioned, I don't know of any of these that require testing to go in. I've gone to a baseball game here in Atlanta. There was no testing required to go in. They might have asked for a vaccine card. I think that, in New York for the dropping of the ball, they're going to ask for people to show vaccine cards. Let me ask you about the vaccine card itself. I keep showing this to get into restaurants and things. My experience is they're not really checking closely at these cards and things. Is that even a functional device at this point?
That's an interesting question. Do I think that it's a functional device and that it's doing what it's supposed to do, which is to not allow people who could potentially have infection spread it in a restaurant? I don't think it's doing a very good job of that. Again, I know multiple friends of mine who haven't gotten vaccinated, who have fake vaccine cards. They're still my friends. I'm not going to treat them any differently, but I do know that they have these fake vaccine cards and they're using them and people are looking at them. And so I don't think that's necessarily the way to go. But I'll be honest with you here. I don't know necessarily what is the correct way to go. I can talk all day about this and I can say we should have done this, we should have done that. But what are you supposed to do right now other than just continue to plead with people, educate them on why vaccines are important, and also increase access to very effective therapies, which we have right now?
But it is one possibility just massive scale of tests, right? Like, even if they're rapid tests, if they were massively available at airports and you required them to get on planes, if they were massively available so that restaurants would have a stash of them that they didn't have to pay for themselves and they could pass them out before people came in, or if a sporting event had them or whatever, then all of a sudden there would be an actual act that you could verify before they came into your facility. Right now, it just feels like it's set up to fail.
Yeah, I agree, but I've often thought about that. What are you going to do? Where are you going to put the testing site? Are you going to put it before security? Are you going to put it after security? Where are you actually going to perform these rapid tests before people get on planes? What about Christmas Eve and Christmas Day when you have a lot of people getting on planes? That's just going to back up airport security. So what people have tried to do is they've tried to put the responsibility on themselves. And unfortunately, we have a lot of people who just power through when they're sick, even if they have the slightest cough or the slightest congestion, right? They just don't tell people. And then that could be coronavirus. So again, I personally think a better strategy is to massively distribute the therapies that work.
Right. I wouldn't, but I would say I wouldn't mind waiting 6 hours in a line. That's better than waiting 6 hours in a hospital bed. But Dr. Rutland, thank you so much for your time. I really appreciate it tonight.